Hi, good evening, and this is In the Public Interest. And this evening I am your hostess, Linda Johnson, and my guest this evening is Dr. Charles B. Simone. Welcome, Dr. Simone.
Thank you, Linda.
I'm always glad to have Dr. Simone.
Always happy to be here.
Now, for those of you that may not be aware, this is Minority Health Month in the state of New Jersey, but more importantly, it's Prostate Cancer Awareness Month. And we're going to talk a little bit, the first half, about good prostate health and some of the issues and some of the screenings with Dr. Simone. And we're going to start off real quick with exactly a definition of prostate cancer, Dr. Simone.
Well, men have prostates and women do not. And the prostates help in different reproductive functions. And it lives down in the low pelvis, and it surrounds the tube that connects the bladder to the outside world through the penis. So it's a vital little organ and surrounds that tube. Now, the prostate enlarges with aging, and that's a benign hyperplasia. It gets larger with aging. But also it can become cancerous, and the important thing is to know that 1 of every 6 men in our country get prostate cancer. That number's been rising since 1960, when it was only 1 in 20. The good news is it's not genetic. The good news is it's related to what we do to ourselves over an entire lifetime. Now, key information. The black American male has a higher rate of prostate cancer than the white by a large amount, 139 people per 100,000 versus 101 people per 100,000. And those rates are the largest, the greatest amount in the whole world. So we really need to be on the alert for prostate cancer in all men in this country. The other thing we have to know is how to detect it properly. You need to get a serum level called a PSA, or prostatic specific antigen. Now, for the white American, the normal is up to 4. For the African American, it's up to 3.5. So those numbers are critical because most doctors remember the 4 number, and if an African American comes in with a 3.7, they rule it as being normal. So you have to be on alert. And why I'm saying this is we have to trust ourselves. We can't rely on many people. We can't rely on governments. We can't rely on these candidates who promise you everything. You have to take the responsibility for your own health in yourself.
So it's like empowerment.
Exactly right.
Which I'm a big proponent of.
And information is the greatest tool that you have. So know these numbers. Know your own numbers. When you go to your doctor, get these tests done, know your own number. Besides the PSA, the serum level, you should always have a digital rectal exam. And that's important. It doesn't hurt. Men worry about it. All men. Doesn't matter about race. They all worry not wanting a finger up the rectum, but you have to have it done because the bottom of the rectal area, you can feel a tumor, a cancer of the prostate gland. So you need both the blood test and you need the digital rectal once a year or so for men over the age of 50 if you're white, and around 35 or 40 if you're African American. And the difference is this, because there's a higher rate, higher incidence. And so you really need to make sure that you're not developing this tumor.
Now, I know that we talked about some issues with prostate cancer before on the show.
Right.
And we're going to talk about some numbers. And I love to put those numbers out because whenever I see men and I take public transportation, and I always tell them, I say, African American men have the highest rate of prostate cancer, not in this country, but in the world.
In the world.
And I am saying this to any woman who is listening, to any man who is listening. It is so important to know these numbers, to be screened, to empower ourselves.
Be proactive.
Be proactive. I like that.
Yeah, have to.
Because we're very big on prevention,
Yep.
especially here in the state of New Jersey.
And we're going to talk about how to prevent this disease from happening, and if you have a prostate cancer, how to live longer with the same plan.
Now, are there, pardon me, are there symptoms for prostate cancer, Dr.
Unhappily, not really. They can vary from hard to urinate or something like that, but they could be as simple as enlargement of the prostate gland giving you the same symptoms. So there's really not a good symptom for it. So you just need to be proactive. Get your screening done every year, no matter what. If you mess up and get it done every 14, 15 months, that's fine, but get it done. Be conscious about it.
Okay, are there certain things that cause prostate cancer? Is it?
Well,
I heard you say it wasn't necessarily. It's not genetic.
No, almost.
Okay.
Only 4 to 7% of all these cancers are genetic in adults.
Are there any environmental factors?
Well, let's go through this 10-point plan, and we're
Okay.
going to touch on them all.
Wonderful.
So this 10-point plan that we created and wrote out in 1980 is pertinent to even discuss today, almost 30 years later. Key thing is nutrition. We know that nutritional factors are responsible for 40% of all men's cancers. That's a big number. 60% of women's cancers. And these nutritional factors are high fat, low fiber, and low intake of vitamins and minerals. Now think about it. What we tell patients all the time is avoid, you know it, Linda, avoid the four-legged animals, the shellfish, and the dairy.
Yes.
Now if you want dairy, it should be non-fat or skim products. But if you get rid of those three big bad guys, you will have a lesser rate of prostate cancer, heart disease, strokes, etc. So that's the key thing. Now when you avoid these higher fat foods, you also bring your weight down. There's a link between being overweight and prostate cancer. There's a link between overweightness, obesity, and prostate cancer promotion. So if you have a prostate cancer, slim down.
Okay.
If you don't, you want to slim down to prevent it. So you get rid of the four legs, the shellfish, and the dairy. You start increasing everything that grows from the earth, fruits, vegetables, cereals, and it's not a big deal. And the government recommends, 6 to 7 vegetables a day, 4 to 5 fruits a day, 2 or 3 scoops of a cereal. None of us are going to do that. The key thing is we need to be conscious about bringing in more fiber in a day to help clean the body out and pull the bad things out of our body. So we need to do that. Also, importantly, are taking vitamins and minerals. Our food supply today is not what it used to be in 1975 even. We're getting anywhere from 14% less to 400% less vitamins in our food supply today. So you do need to supplement your diet with vitamins and minerals. That's critical. What vitamins and minerals? Let's talk about a few. Antioxidants, don't want to bore you with a big name, but you've heard about it. Beta-carotene, everyone knows that. Vitamin E, vitamin C, selenium. These are the big 4 important anti-cancer, anti-heart disease agents. You add to them the B vitamin complex, and that's a great thing to do. So those 2 things. Another thing you should add always is a calcium base, and this will help promote prostate health, colon health, etc. And one more thing I always like to add is aspirin. Aspirin's a critical thing to take in the evening. It'll decrease the risk of cardiovascular disease, but also decreases the risk of cancer spreading as well.
At what age should a person, man or woman, begin to do the daily aspirin regime?
I think in this country, because there's so many risk factors that we incur, after age 35, 40.
Okay.
And I think that's a good age to do that. Vitamins and minerals should be started early in life. The earlier, the better, the lesser the risk overall. In fact, if you start bringing in vitamins and minerals early in life, between ages 3 and 10, you can increase the IQ by 12 points.
Interesting.
Very important.
Okay, now, I know we talked a little bit about the digital rectal exam, which I know because I'm doing a screening on Saturday, September 20th, and the men never want to hear about that. But it is an important piece.
It is.
Along with the PSA.
That's right.
Are there any new tests that are being developed?
Just that you mentioned. We published already in the year 2001, 2002 in the Journal of the National Cancer Institute a new test called a proteomic screening. What that simply means is this. We screen for tens of thousands of proteins in the bloodstream, not just the one PSA, but we're looking at the whole constellation of the makeup of a person, 10 to 20 and 30,000 proteins at one time, looking for a pattern. And the pattern is this proteomic pattern. So we find a pattern that's normal, we find a pattern that's abnormal, and we realize who has a problem and who doesn't. Now this test will screen and find cancers several years earlier than the PSA right now.
Is it a blood test?
It's a simple little blood test.
Okay.
Yeah, very simple blood test. And it's exciting. It should be released soon for commercial use. It was done on the NIH campus together with myself and others. So it's in the hands of the government, it's in the public domain, but we need to take control and start changing our lifestyle and not worry about the testing as much as lifestyle change.
So you're talking about doing prevention.
Prevention is critical.
That's a very
Because,
key thing.
You know, we saw this big show, fancy show last week on the air, 1 hour show. Give money here, give money there.
Stand up for cancer.
But where's that money going? No one told you where it was going. So they want to give you the money. Where's it going? Where's it going? Always for cancer research. The key thing is not research for cancer anymore. It should be put into prevention.
Prevention.
That's the name of the game. That's how you're going to win this battle. You'll cure cancer if you can prevent it.
I hear you.
Yeah.
So I know you're a very big proponent. The Truth About Prostate Health and Prostate Cancer is a book that you've written. How long ago was it written?
Just a couple of years.
Just a few years ago, but it's still relevant today.
Oh, yeah.
And I'd like to just take a few minutes to say on September 20th at the Family Health Center at Capital Health System, we will be doing free prostate screening.
Yep.
All you have to do is call 609-815-7188. And I'm very happy to say I've been getting calls all day from men and women.
Good.
The women who love them.
They need them.
Because I say that all the time. Men, we care about you, whether you're our dads, our grandfathers, our brothers, our cousins. We care about you. And since we know we're the ones who can get you to go, come on out. 609-815-7188.
That's great.
Okay. Thank you, Dr. Simone.
Pleasure. Thank you, Linda.
And